So in this video, I want to discuss the general algorithm for the tetanus prophylaxis. As you know, the general guidelines recommend the tetanus vaccine at ages 2, 4, and 6 months, but you can get additional doses between ages 15 and 18 months. And from there, you can even get additional doses between 4 to 6 years. So let's talk about what the algorithm says regarding prophylaxis. So the first thing you always want to ask is how many doses of the vaccine has the patient already received? So we can divide this into the 3 doses or less than 3 doses, or if the number of doses is unknown. So the next question you're going to ask is, how does the wound look? If the wound is clean and minor, or if the wound is dirty and severe. So clean, or minor, or dirty, or severe. That's the second question you're going to ask. If the wound is clean and minor, and it's been longer than 10 years since the previous vaccination, then you can go straight and give the vaccine only. However, if the wound is dirty or severe looking and it's been more than 5 years, then you can go again to the vaccine without giving the immunoglobulin. But what if the patient has had less than 3 doses, or if the patient does not know their vaccination history? Again, you have to look at the wound and see if it's clean and minor, or dirty, or severe. So if the patient has received less than 3 doses, or the previous history is not known, but the wound is very clean looking, then you can go straight into the vaccine. However, if the patient has less than 3 doses, but the wound looks very severe or dirty, then in this particular case, you're going to have to go for vaccine plus the immunoglobulin. So to summarize, the first question you always have to ask yourself is, how many doses of the vaccine has the patient received? If it's less than 3 doses, the next question is, how does the wound look? If it's clean or minor, then you have to ask, is it more than 10 years? If it's more than 10 years, then go for the vaccine. If it's a very dirty wound, but the patient has received all 3 vaccinations, then it's 5 years cutoff. If it's more than 5 years, then you have to go for the vaccine. Then if the patient has less than 3 doses, or if the vaccination history is unknown, but the patient has a very clean wound, then again, you can go for the vaccine. But if it's a very dirty wound or severe looking, then you have to go for vaccine plus immunoglobulin. Thank you.